because we've got one of our own, Carrie Donarajan, who is our assistant director for our 10 Start teams, who is here to present today on a topic that is one of the most important topics that we've ever had on this CCN, because it is of critical importance that we attend to grieving for people with intellectual and developmental disabilities. And unfortunately, Carrie, I have had so many experiences with this where we kind of think about people with disabilities as not having sometimes the capacity to deal with grieving. And so we end up, unfortunately, sometimes trying to protect them so much from different sorts of things that are going on that they don't get the opportunity to properly grieve and to deal with loss, and to deal with and loss thought kind of writ large, lots of different areas in which people experience this type of loss that is not just about death but about other losses that we have throughout the courses of our lives. So I'm so happy to have you here today to talk to us about this and to tell us a little bit more about what we should be thinking about when people are going through that type of loss and grief. So, Carrie, welcome today.
Thank you. Thank you. I'm also very excited to share this. And it's kind of going to be a little bit of a co-presentation with a Start National Training Series video that I came into my email recently. And when I watched it, I thought, oh man, this is a topic that I really want to share. So we're going to do a little bit of video, a little bit of a presentation, and some discussion. So
Outstanding. And so, before we launch in, though, how about if you just kind of introduce yourself, tell us a little bit about yourself and how you got to where you are right now.
sure. Well, I'm a behavior analyst by training, and I am currently the coordinator of behavior services here and the assistant clinical director with the START team. But I started as a lowly, practicum student working with Bruce some years ago. We won't say how many. And I had never considered working in the field of intellectual disabilities, but that experience really started my career on a path that I didn't expect. And so I had worked as a regional behavior analyst here in Tennessee, in the Middle Tennessee region. And then I went to Georgia and worked as a regional behavior analyst there as well in the state of Georgia. And both locations were working on, closing institutions and helping people get out into the community and live richer, fuller lives. And I think that has been really exciting for me to be a part of that. And then I went to work for as a behavior analyst contracting and working more with kids with autism, with their families, a lot of in-home work, a lot of in-school work, and that is also beautifully rewarding, working on verbal skills and helping kids be better integrated into their family and community. And so that was a real joy for me too. And then just in July, I was honored to be able to return to Tennessee and come back to work for the Department of Intellectual Disability. So um, that's kind of a summary of my career, but I'm excited to be back.
Yeah, I was so glad when you were willing to come back to DIDD after all those years away. We were very excited to have you back. So that I'm so excited to have you here today, but also just so excited to have you on our team because
Thank
you're a
you.
great member of the team. You were great back then, and that carried over to now. So now I always ask about an interesting fact from each person that comes on, each guest that we have. So can you tell us a little bit
Yeah.
about your interesting fact?
I've been thinking and trying to think what would be the most interesting. And I think the most interesting thing I've done in my life was I spent 5 months in Pakistan as a high schooler, and I went to school there, and I lived with my aunt who lived there. And it was interesting and exciting. We ate all kinds of foods and did all kinds of things. And that's sort of my claim to fame.
Okay, was that in Islamabad or
Um,
Karachi or Lahore?
I was lucky enough to go to all three of those cities, but we lived closest to Islamabad, actually in the mountains, in a town called Murray. And she was part of running an English, like a school there, a Christian school for the children of missionaries, and also for other workers in the country with kids. And so that's where I lived.
Wow, that is an interesting fact, and that's the first time I've ever known that about you as
Thank
well.
you.
So I'm so glad you shared that. Well, you're here today to talk to us about such an important topic, in grief for people with intellectual and developmental disabilities. So, with that, I'm going to turn it over to you and let you guide us.
Okay. So I'm going to start with our regularly scheduled Smarticle. But let me share my screen and get to that. So, all right. Can everybody see that? Is that we shared
Yes, we can
successfully?
see Maxwell Smart there on
Okay.
his smartphone, on
On
the original smartphone, I guess.
That's right. That's right. So my article is from Harper and Wadsworth, and it is Grief in Adults with Mental Retardation Preliminary Findings. And of course, this article is from 1993, so they are using, terms that were the appropriate terms at that time, of course. But I think I use intellectual disabilities going forward in what I added to the typing. So the method on this study was that they had 43 people with intellectual disabilities, 23 women and 20 men, and they interviewed those people, and they also interviewed 100 providers of services, including directors, psychiatrists, DSPs, clergy, funeral directors, and psychologists, which I thought was a really interesting group. But these were people who obviously interacted with people with intellectual disabilities and had the ability to kind of comment on their response to loss and grief. The people were assessed for grief symptoms using interviews of the people and of the support staff. And the hypothesis of the article was to really look at the grief response in people with intellectual disabilities, and that it would be similar to those without an intellectual disability. And also to look at whether people with intellectual disabilities understand the finality of death. So that was what they were looking at. 50% of the participants reported that they had a death in their life that was disruptive. And a death or a loss, I guess you could say, in this graph, this table shows a parent or step parent was the number one loss, but also a sibling, a roommate, and that would mean not the death of a roommate necessarily, but just the loss of a roommate, the loss of a counselor or a care worker, a caseworker, aunt or uncle, grandparent, and pet. So you can see that that's quite an extensive list, and that they're feeling these losses that many of them are experiencing quite frequently. 99 out of the 100 professionals knew a person, that should be KNEW, knew a person experiencing grief, so that they had experience with people with IDD experiencing grief. And grief responses reported were very similar to what is found in the typical population. So you can see, crying, sadness, irritability, grouchiness, sleep difficulties, fatigue, loss of appetite, hostility toward others, verbal or physical, body aches, pains of all types, anxious, confused, and then they listed, by area the symptoms. So I think when we think about the people we serve that are going through grief or having losses in their life and their history, and we see some of these things, sometimes we're quick to say, this person's having a behavior, this person's having a problem, a medical problem, we need a medication, but grief might be underlying. And so I think that this part of the study really showed that they're experiencing these typical symptoms pretty frequently. Another thing that happens for people with intellectual disabilities, and that this study really found, is that they're often experiencing other life changes in conjunction with the loss. So 25 participants in the study reported that the death was very disruptive to their life. And 18 participants stated that 1 year later, they continued to face problems based on that loss. And so I thought this table was really helpful from the study, that it might have been institutional placement from their home. So their parent passes away and then they have to go into an institution. This, of course, was done in the 90s. So a lot of the institutions were a lot more, were still in effect. Some of
Well,
them,
yeah, Carrie, when you think about it, people in our system get moved around all the time. They might move on from one set of caregivers to another set of caregivers. And these kind of losses, I think, get lost all the time. Really not even interpreted as loss for people when they really might be very important losses to them.
Yeah, I think that's a really good point. For sure. I mean, if you've ever moved, it's traumatic at times, and I think sometimes we move people around and we don't give them a chance to have a voice in it, or to just talk about what they're missing or what they're sad about. Um, some of the losses meant, fewer visitors or no visitors coming to the residence. It might have meant placement with a relative, a decrease in recreational activities, a new roommate, a decrease in income, a lost job, or becoming their own guardian, which is huge. That's a major life change that might have just happened suddenly due to a loss. And then greater than 50% of participants reported still feeling loneliness, sadness, and other symptoms 1 year after the loss. So these are people who are, going through this experience. And on this table, it hit me hard when I saw cannot locate the grave. That might be something that's really bothering the person, and they just don't know. I mean, I've worked with people who no one knows because the person has moved, they've changed agencies, and it's totally been lost track of where their mother was buried, and they want to know. And so these are things that can really impact how they're feeling and how they're reacting. Um, and then, inadequate income to meet their needs. They may suddenly just not have enough resources. So um, there are many ongoing problems that can follow people after they have a. And again, just another table from the article that talked about just some of the physical reaction, or some of the other reactions to grief that might impact them: headaches, hyperactivity, suicidal statements, pretends to be dead, increase in sexual behavior, major behavior change, bizarre behavior, some hearing voices. I mean, so you can see that many of these things we might just be like, wow, this strange thing is happening with this person. And it might be a grief response, and we're not really identifying it as such. And a lot of these things that are mentioned in this article are going to come later too in some of the other stuff that we talk about. So I'm kind of going through this article quickly, but we will touch back on some of this stuff. But one of the things I thought was really interesting that was in their sort of like, results or final thoughts about the article was that the providers, 100 providers on all different levels, basically reported that they had little to no materials or resources available to assist people with intellectual disabilities with their grief. They just basically said, we don't know what to do. We don't have any resource. We don't have any material. And those providers also noted that the grief reactions lasted on average for a year, and some longer, and of course some shorter, depending on numerous factors, a lot of it having to do with the person's developmental level, but also the resources that they have, the other supports that were in their life. So do they have a network that's helping them deal with that grief? Depressive disorder can be co-occurring with grief, but we need to avoid the diagnostic overshadowing in order to ensure that grief is addressed. So we may be thinking, oh, they're just depressed, when it's really a grief response, but we also do need to be aware that you can have co-occurring depression and grief. Participants were able to show an understanding of the finality of death, even those on a very low cognitive developmental level. They were able to understand that people are not coming back, that death is final. Those sorts of concepts were shown, and they hypothesize in the article people may develop some scripts that assist in helping them understand death. So they've had a pet, it died, it did not come back, and so they kind of develop a story, or they've been to a funeral, they've seen what's happening, and then they know that person doesn't return. So I think that's another argument that the more that we talk about death and we expose people to death and we put that in the open, the better they are going to be in dealing with the death of a close loved one when it does occur, because they'll have developed some of those scripts. So that is a SMARTicle. So, I mean, I want to pause there if there's any thoughts or comments on the SMARTicle.
Well, I'll comment that this is a great SMARTicle because it really sensitizes people to some of the issues that people with IDD may be experiencing. And I was remembering back, there was a book years ago called "You Got People." That was a quote from one of the folks that the book was written about, who talked about having people around them who supported them through the death of a loved one, and how important that was for them. And we were talking about different types of loss too in that book, and in as in our experiences. The idea of moving from one place to another. I've seen situations where people just move. They don't even tell the person they're moving because they're fearful that it's going to upset them to know that they're moving. But so they don't tell them about it and just drop them off at another location. And, that's not a good formula for a good response. And so you can oftentimes kind of cover these things up, but people with disabilities experience the consequence of it. And people need the opportunity to go through a proper grieving process if they're going to continue to be stable. And one of the biggest problems we deal with in, say, borderline personality disorder is inhibited grieving, because people don't want to express themselves about what's going on with them for fear that they'll be punished for it. And so this ends up being just a critically important topic, I think, for us all to attend to.
Yeah.
Yeah, I wanted to comment too. I think that piece where you're talking about individuals kind of transitioning from one provider agency to another and information getting lost, such as where the gravesite might be for them to visit. I mean, that's huge. I mean, if you think about it from your own perspective of if you've lost somebody and then all of a sudden you're disconnected from not only where they are for you to visit that grave, but also just for other people who were there with you alongside you when that occurred, and no longer having that support and understanding, and maybe that piece didn't get translated into the documentation as well. So you really just kind of get separated, and it gets lost in translation for for lack of a better term. And I think that's a huge point to make, is that that can be very critical for someone. And I can't imagine having lost someone important to me like a parent and then being taken away from anyone who knew about it, or for me to be able to go and visit. Or I just think that could be so traumatic for a person, especially if we don't process
Someone
the
I
grief with
work
them to begin with.
Yeah, someone I worked with before had not even been. They had been, out of the home, away from their family, and so people had died during this period that they were away, and they had never been to obviously didn't get to go to the funeral under that circumstance, but had never seen the grave site or anything like that. And these things all play such an important role in grieving that they didn't get to do. One of the things I was able to do with that person was, because I have an ancestry.com account, there's this service out there on the internet now. Find a grave, and you can actually find a picture of the grave where the person was buried. I mean, obviously, it'd be great to travel to that location and actually see it, but in the interim period of time, we were able to do that, and it just helps the person feel more integrated. So it's critical stuff.
Yeah. Well, and I wanted to start before I start the video part. I did want to tell a story of a man that I worked with, and he was had very limited communication skills, and it was very difficult to tell, how much he understood about what was going on with certain, long-term aspects of his life. He knew what we're like today, and we're going to do this, but and he spent a lot of time with his mother, and he loved his visits to his mother's house. She visited him. It was a huge social support. And one day she passed away very unexpectedly. There was not, a prolonged illness. It was just sudden. And there was a great debate in the agency. What are we going to do? We can't take him to the funeral. It was sort of like what everyone was thinking, like, this could be a disaster. What could we do? He'll get very upset. And then what's he going to do in the future when his mother doesn't come and doesn't show up? And thankfully, I'm really thankful that in the debate, they realized that the risk of him wondering where his mother was greater than him having an issue at the funeral. So they took him to the funeral. And they took him before a lot of the people came, I guess you'd say more during the viewing period. And he went up and he was able to see his mother and he was able to touch his mother. And he did. And he looked at her and he seemed to understand the finality of death. Even though his capacity was limited, he touched her face, he saw her, and he left that funeral. And he didn't have some of the behavioral issues that we had expected in relation to where is my mother. Now, I mean, I'm not saying that he didn't grieve and he didn't have other behavioral issues related to that, but I feel like that was such a wonderful thing that he was able to do, and that has made me think throughout my career about the importance of this topic. So that being said, I'm going to start start as a national online training series. I will share the information for that in the chat so that if you want to see the whole video, you can. We're going to watch about 17 minutes of the video and then have a little bit of time left at the end. I want to present also some additional information about interventions and preparations that we can do to help people with grief. So let me get that. I'm going to start it, and if you can't hear it, Bruce, please let me know. But it should be correct.
Good afternoon and welcome to the National Online Training Series on Mental Health and Intellectual Disability. Many thanks to our co-sponsors for making this series possible, and welcome and thanks to today's presenter, Dr. Katie Stratigas. Welcome, Dr. Stratigas.
Hello, everyone, and thanks for joining us today. We're going to be talking about bereavement and grief in individuals with intellectual and developmental disabilities. My name is Katie Stratigas, and I'm a child, adolescent, and adult psychiatrist, and I'm the medical director for the Triborough New York START, which is in New York State, and I'm also on voluntary faculty at Columbia University. So our outline for the day is as follows. We're going to talk a bit about the epidemiology of grief, grief in children, traumatic and complicated grief within both the general population and more specifically within individuals with intellectual and developmental disabilities, which I'll just say IDD going forward. And then we'll talk about strategies and interventions for individuals with IDD who are suffering from traumatic grief. And I give you this presentation today really as an invitation to think about the individuals that you serve. And at START, we're always very mindful of thinking about things that others may have missed, be it anxiety or trauma. And I would encourage you to think about grief in a similar fashion. It's incredibly common and it really affects the individuals we serve, but time and time again gets overlooked as a major influence on their psychiatric presentation. So that's really my goal today, is to leave you with, with having this in mind as something for your serious consideration. So to get us started, a little bit of background about the epidemiology to really kind of share with you how common this is. So this is from a paper by a child psychiatrist looking at children more broadly, not specifically with IDD, but it just gives you a sense of how prevalent this is. That 78% of kids between the ages of 11 and 16 report having experienced the death of a person close to them. An interesting Swedish study found that having your parent die in childhood, so parental death prior to age 18, led to an increased risk of suicide for up to 25 years later. And parental loss in childhood led to a 50% greater mortality rate for that child as an adult, meaning they also were at risk of dying earlier. So the effects of grief in childhood are really very long-lived and really can show their effects years and years later. In another study, 70% of US teachers knew at least one student who'd lost a loved one in the past year. And symptoms noted in those students included very common symptoms that we see in psychiatry, including impaired concentration, social withdrawal or disengagement from the classroom, depression, sadness, absenteeism, so missing school, anger, and lower quality of schoolwork. So it really has a major impact on children. In terms of the types of losses, again, I encourage you all to think very broadly. Classically, obviously, there's death of a loved one, but for the individuals with IDD, it really can involve a variety of losses, some which we might not even think of immediately as rising to the level of having a psychiatric impact. This could include death of pets, death or loss, really loss of family through separation or divorce, loss of home, due to moving, loss of neighborhood friends, changing school through moving. Something that may be viewed as an opportunity for a parent really can involve a lot of loss for a child or another individual. Loss through adoption, foster care, loss of a loved one due to homelessness, addiction, or incarceration, or loss due to medical illnesses. So the classic writer on this was Dr. Kubler-Ross, who wrote the classic 5 stages of coping and mourning with dying on Death and Dying, her seminal classic written in 1969. And just as a refresher for all of us, the 5 stages, which at the time the thought was that one would go through these sequentially, and now we just sort of appreciate that they're different stages, that one will go through in varying combinations and varying lengths of time. And that fundamentally, our individuals with IDD, may well experience these stages as well. The stages are denial, which can include a sense of numbness, it's all a mistake, this didn't really happen, a false sense of hope, not accepting what has happened or avoiding thoughts about it. The next stage is anger, which can include frustration, irritability, why me, this isn't fair. You might blame others or question God or your spiritual system. The next stage is bargaining. If only I had done X, Y, Z, what if I had done this? What if I had been there? All of these what ifs, trying to rethink the whole thing. And then we have depression, right, which is most commonly associated with grief, emptiness, feeling overwhelmed, and at times suicidal thoughts. And the idea is if you work your way through all of these, eventually you'll get to acceptance, which doesn't mean that you accept the death, obviously, but it's more of like a stability, right? Your emotions stabilize and you kind of come back to reality, a new reality, but really kind of your homeostasis. And fundamentally that you have more good days than bad days. So it's not the elimination of all difficulty or negativity with this, but just that the good days start to outweigh the bad days. And in more recent iterations of this, a 6th stage has been added by Kubler-Ross's colleague, Kessler, and that involves meaning and really making meaning out of all of this. And so we're not going to get into that today, but he is actually coming out with a new book in this year about meaning. More recently, task models of coping with grief and loss have been described. And the idea here is that you go through different tasks at different rates and in different orders. And so it's a little bit more of a fluid system. So some of the tasks that one might go through are accepting the reality of the loss, working through the pain and the emotions, adjusting to the new environment without the deceased individual, relocating the deceased within one's life, memorializing the deceased. And the idea is that the tasks involve physical, psychological, social, and spiritual tasks. And these were summarized by Worden and by Core. And so that's sort of a preamble to us kind of focusing in on loss in individuals with IDD. And the history here is that there's a sense or perception that individuals with disabilities don't understand death. Right, death or its irreversibility. And so there was a long history of not telling individuals about deaths in a timely fashion, individuals not being permitted to go to the funeral out of concern that they would get upset, people not being permitted to grieve with their families, being kept ignorant of information that they needed to understand what was happening, being provided with minimal support to cope with the loss, or being sent off on a respite or a trip while the rest of the family grieved and kind of worked through their loss, but then the person was behind. They didn't have a chance to kind of participate in that grieving process collectively with loved ones. And it ends up being another loss on top of many prior losses and is not kind of given the openness and the experience for the individual to kind of work their way through it. So unfortunately, some of those attitudes persist today. But in terms of current times, as lifespans increase for individuals with developmental disabilities, concomitantly, there's more opportunities for loss. And sort of the classic one that every parent dreads is the death of a parent, right? And what will happen to my child, my adult child, when I die? You know, and that's kind of the penultimate, but there are many other common losses. So, you know, your caregivers may change, and you may have very little control over this. A staff member may change. You might get a different roommate if you live in a residence or some sort of facility like that. And the worst case scenario, as we alluded to, is when the final surviving parent dies, if the individual is admitted to the hospital but never is able to return home. I mean, that's really quite a tragedy, and really the worst case scenario. So the idea is that with proper planning that we'll talk about, you know, there should be a plan in place before this moment of distress, so that it can be done in a way that's much better for the person's psychological well-being and that they can understand. So in terms of just normal benchmarks of grief in children, and you can see from this slide, I mean, there's just a lot of ways that grief can present in children, and a lot of them look psychiatric, right? But really makes sense if you think about the loss and the grief. And so in terms of emotional symptoms, this can be sadness, anger, blame, guilt, you name it, it's there. Fearfulness, anxiety, irritability, confusion, loneliness, feeling overwhelmed or as if you're going crazy, disbelief, a lack of motivation or ruminating, a yearning for the lost one, and an increased oppositionality. And in terms of behavior symptoms, you can have fatigue, poor concentration. Well, these would be more neurovegetative, actually. Sleep issues, GI issues. You can get physical complaints. There could be regressions in terms of things like bowel and bladder continence, aggressive outbursts, nightmares, restlessness, imitation of the deceased, talking about the deceased a lot. There can be a decline in functionality and school performance, like what the teachers had noted in that other study we talked about, and self-injurious behavior. So you see it really runs the gamut of symptomatology, and again, really can be misdiagnosed and missed and thought of as something else when really what you're seeing is grief. So in terms of typical grieving in individuals with IDD, you know, fundamentally, people with IDD react to loss and grief in ways similar to anyone else. So there was a great quote, feelings are not measured by IQ. And that was from a tip sheet from the Vanderbilt Kennedy Center around grieving and loss. The effects of bereavement may be anxiety, depression, irritability, distress, or behavioral changes. Again, many of the symptoms that we saw in the last slide, right, very well can present in individuals with IDD, and, you know, just as we said before, can be misinterpreted, and the grief not acknowledged or appreciated. And the overall summary, you know, at least from the Kennedy Center, is that protecting individuals with IDD from death may well cause more problems than it solves. Within DSM-5, there is a disorder that's in the for more study category, but it's useful for us to think about persistent complex bereavement disorder. So again, it's not a formal disorder, but it's in the section of the new DSM-5 around disorders that they would like further study. And they're summarizing it as grief that is intense, turbulent, intrusive, prolonged, and maladaptive. And it must last for at least 6 months in kids, 12 months in adults, which gives you a sense of timeline, right? That in the short kind of aftermath, you can have a lot of those descriptors. But again, if the time course is brief, then we would say it's sort of part of the process of normal grieving. But again, this is a persistent grief that involves separation distress, and that is defined as yearning, searching for a lost one, experiencing profound loneliness, traumatic distress, which is numbness, disbelief, feeling stunned or dazed, having a fragmented sense of safety and trust, right? And that is so important to reestablish the sense of safety and stability for our individuals with IDD, as well as intrusive thoughts about the deceased. And it's associated with long-term functional impairment. So again, anything that's actually a DSM disorder needs to involve impairment in functioning. Versus healthy grieving may be very, very, very difficult, but ultimately may lead to positive growth. So traumatic grief within the general population ends up being a risk factor for suicide, psychiatric and physical illnesses, and actual death itself. And traumatic grief is considered separate from anxiety and depressive disorders, and it predicts morbidity much more so than the depressive symptoms. So again, this was a nice quote from Brickell and Munir. At its core, the concept of pathological grief is the acknowledgement that some individuals in some circumstances cannot recover effectively from grief, right? So we all experience grief, but it's that ability over time to recover, to move forward, to make meaning. And not being able to do that really is what's at stake in traumatic grief. So within the population of folks with intellectual and developmental disabilities, folks may respond very emotionally, as we discussed, being sad, angry, anxious. And they also may respond in behavioral ways, including increased irritability, lethargy, hyperactivity. And this is a little bit of a repeat from what we were saying before. But the idea is that perhaps individuals with IDD are at increased risk for traumatic grief due to difficulties or limitations in their communicating about the loss, perhaps in people misrecognizing their grief and not speaking about it with them. They're also at increased risk for secondary losses, in that if they lose, for instance, a parent, they're also potentially going to lose the way of life that that person lived and the life that that person had built for the individual, right? So an individual who's been living at home, let's say with a mother or father who had a whole life around that existence, and then if the parent dies, not only have you lost the parent, but you've lost that entire environment, that entire structure and way of life. And that it can be very difficult finding meaning in this loss due to, again, cognitive and language limitations, and or perhaps not being given the opportunity to kind of work through this the way the rest of us might if someone important to us dies. So I've been saying this all along, but it's also been studied that others tend to underestimate the loss in individuals with IDD, right? So we tend to gloss over, the death of someone or some change. And it really does have such an impact. And the other piece to keep in mind is sort of the developmental profile of the individual may impact how they respond to it. Right, so like an adult with a younger developmental age may respond more as a younger person or a child to the loss. So you have to think of them developmentally, and it can present with things like separation anxiety, social withdrawal, or behavioral changes. So you want to, again, as we always do in understanding folks with IDD, sort of think about what is their, what is their developmental age, more so than their chronological age, and how does that give us insight into how they might grieve the loss of a loved one. So can traumatic grief as a term be used to think about individuals with IDD? Again, I think the biggest thing here is diagnostic overshadowing, right? Which is seeing the symptoms, all of those symptoms we discussed, but not seeing the way that grief is implicated in them, right? So you may miss the grief, and caregivers tend to underestimate the impact of grief on individuals with IDD. And sometimes they're struggling with their own grief as well. And it's worthy to remember that grief can trigger a reemergence of underlying psychiatric illnesses as well, be it depression, psychosis, mania. But again, I think missing the grief and under-responding to the grief, underestimating it, if I could leave you with one kind of heuristic clinical point, it would be that, and to look for it.
All right, that is where we're gonna end our video time. And just talk a little bit about grief with adults with intellectual disabilities. Are you able to see my PowerPoint now okay?
Yeah, Carrie, can you remind me the name of the person that was the presenter there?
Yes. No, I can't. I have the link here, but I don't have her name.
But she's with New York Star.
Yes, she's with the START program. And Michelle is going to help me out and share that link in the chat so that the whole video is 43 minutes. And there's a lot more really good material, and some of it you'll see is in this material that I'm about to present as well. But
Okay.
I'll add, she's Katie Stratigo. She's the medical director for the New York START Tri-Borough region.
Okay, very
Thank
good.
you.
Thank you.
It's too hard juggling all the screens to look it up. while I was talking. Thank you, Michelle. The other resource I pulled for this PowerPoint is how to talk to someone with an intellectual disability about death, even if you aren't sure you should, which was Reef Counseling Services. I just found it online, but I felt like the material was really helpful in sort of conceptualizing how we do this. So just want to touch on a couple myths about people with IDD and death. So one myth is that they won't understand, and she mentioned that too. So it's confusing to talk to them about it. So we're just not going to talk to them about it. That's one of the myths. The second one is that they don't experience grief. So it's pointless to talk to them about it. So we're not going to talk to them about it, right? And then the third myth is it will upset them unnecessarily. So it'll be easier if we just act like nothing happened. And so we're not going to talk about it, right? So I think a lot of these myths boil down to that it's difficult to talk about these subjects with anyone. Death and dying and our grief, it's not an easy topic, and then it's compounded by some of the other issues that we face. So but it's really important that we dispel these myths and move forward and talk about grief with the people that we serve. So when starting a conversation about loss, it's really important that we confirm that the person understands using their preferred communication method. So this might mean you have to be creative about how we talk about grief, but I think it's possible with pretty much everyone that we provide supports to at least broach this in some way. I think we need to anticipate there are going to be questions that they can't articulate, that they're not going to be able to find the words for, and so we might need to be ready with some responses or ways of presenting materials that are a little bit out of the box. And there might be some bizarre responses. You might get a weird question back when you bring up the subject of death or dying or being sick or loss. So be ready for that and be ready for maybe some behavioral responses that are unexpected. But most importantly, if we can validate the genuine emotional hurt and worry, let them know that like it's normal to hurt and that we are listening, that we understand, that we're trying to help them process. I think that's the most important takeaway when we start these conversations. So I want to talk about some strategies for managing loss. And I think one of them is just talk about death often, even when no one is sick or dying. And I think that's important for the people we serve. It's important to do with children in general. And just start those conversations in easy ways throughout your daily life. So you might use animals as a way to start the conversation. We had a dead squirrel in our yard the other day. So we had a little conversation about death in our household. So you might use things like that, or a loss of a pet, which is a little easier than the loss of a parent. So that might also be a start of a conversation. You might reflect on movies that discuss death and loss. So I have Bambi here because I distinctly remember when Bambi's mom died. Spoiler alert if you haven't seen it, in that movie. And I mean, you can't help but have a conversation after seeing that with a child who's going, wait, what do you mean his mom died? What does that mean? And so you could have a similar conversation about whatever material you're watching on TV with the people we serve. And what are your thoughts about it? How did that feel? What did you think when that happened in the show or the movie? We need to use concrete language and not euphemisms. So we should keep our communication and language simple and use concepts that the people we serve can relate to. And avoid phrases like they went to sleep and didn't wake up, because that's like, well, could I go to sleep and not wake up? And it doesn't make that concrete link to what is happening. And also remember that, nonverbal cues and body language really express a lot. And so by trying to kind of hide or cover things from a family member or a person served who is going to be facing death and dying, they probably are picking up a lot of that anyway. My father tells of when his mother was very, very sick when he was a boy, and they told everyone that she had a tumor and not that she had cancer, and they didn't tell them that she was terminal and very close to the end because they thought it would be easier for the kids to process. But my dad said, I knew that she was really sick because everybody acted like she was really sick. And it didn't help him to be told it was a tumor and maybe it's not that serious. So that, I think it's very important way to remember that it's really important that we be clear, and concrete with people who are going through this. And when a loved one is sick, keep the person up to date. Give them status updates they can understand. So if their mother's in the hospital, or an uncle has cancer, and they can understand, we want to give them all those updates that the rest of the family is probably sharing. I mean, obviously to the level that is appropriate for their understanding. Be prepared for a lack of questions or unrelated follow-up. So when you're having these conversations, give people time to process. It's not going to always make sense right at the beginning. It's not always going to make sense, even after an event has happened, even if they've been part of the funeral and part of what's going on, the effects of the loss may come a lot later. So one story that they shared was that, a girl didn't really understand her father was gone until someone else started mowing the yard. And that was like, oh, he's not coming. He's not doing his job. So he isn't coming back. Might be when you get to the holidays and grandma doesn't cook her, her pie that she always brings to the holiday dinner. That might be when a person really comes to understand. I think this is true for all of us. A lot of this material is presenting in terms of people with IDD, but I think we all can really relate to how these sort of like small losses that continue on. And I think that's where, when they talk about a year of impact, I think we can see that. So each new event brings a new level of grief, a new level of loss, because that person isn't here with us anymore. We may need to model asking questions or sharing feelings. So encourage communication about the loved one. It shouldn't be a situation where someone disappears and we just don't talk about them anymore, right? So for those with limited verbal communication, we may need to use visuals. We might have rituals or images, things that remind of the person. There might be a necklace or item or photo or heirloom, something to touch. I have a picture of my grandparents, and I often touch it when I walk past it. Just my way of remembering that connection. And so I think that the people we serve, they very much need these ongoing connections with some tangible thing that can help them remember. And we want to continue that connection with the past with either pictures, a memory book, a box. You might want to visit places that they used to go. I had a friend recently, she lost her parents. And they used to go to Chick-fil-A every Saturday morning. And she continued going to Chick-fil-A on Saturday morning because that was her way of just memorializing them and remembering them. And so, if we have people we serve and they have a regular routine with a parent and that parent passes away, we may want to continue that routine and try to find some new supports to be part of it so that they don't lose that connection to the people that they love. You might light a candle or say a prayer, be involved in, whatever religious ceremonies or remembrances that are part of their culture or history. And then you might talk about how the loved one would be happy. Like, oh, your mom would have loved to see you dressed in that dress to go out, have a party or whatever. Those are important conversations to have. So we also want to remember to address the questions that are not being asked. So if they've lost one supporter, there might be fears that I'll lose another supporter. Like, what happens if I continue to lose people? Am I going to be on my own? Am I going to be by myself? It's important to anticipate concerns like that and address them. So when staff turnover occurs during times of loss, the staff should be made aware of the loss and prepared to provide support. Like we talked about, not losing the thread of some of these things, like keeping information, maybe an information book with like where the grave is and our rituals and what we do and the things that this person likes to do maybe on a more annual basis. Some people like to visit the grave on the anniversary of a death. And so we might need to share that information so it doesn't get lost. And there might be questions about illness or who might fill certain roles in life, what will happen to other family members or pets. So like if this person passes away, who's going to take care of, the dog, or who's going to take me to shopping like someone always does. So be prepared with some answers to these questions. But definitely during these periods, avoid expressing hope as fact, like, oh, he's going to be fine. Don't make those kind of promises because we can't ensure that. And that goes for also staff remaining in the home. Like it might be like, I'll always be with you. Well, will you? I mean, this is a job, so you might end up not being able to continue with this job. So we always need to be careful about the words we use with the people that we serve so that they'll know what to expect from us, and that when changes happen, they'll be more prepared for that. I know we're coming down on a few more minutes, but I want to make sure to get to these proactive strategies because I think she touched on this in the video a little bit. And then if you watch more of the video, you'll see that she talks a lot about planning ahead for loss. So it's really important that you plan ahead for loss. And I think any person served whose parents are still living, it's time to have this conversation, even if they are 1 year old. What's going to happen, when you pass away, or what's going to happen if the current care situation can't continue, if a person's being served in their own home. So that's not to that's not to try to get people out of their home or to scare people, but it's to have that conversation so that there's a plan. And especially as parents start to age, you can actually talk with the person about what's going to happen. You can make those financial plans. There can be supports in place, because it's really important that if a person loses someone very dear to them, very core to them, like their parent, that there not be other major life changes for about a year, if possible. And sometimes that's really hard because placement might have to change. But with the right planning, it's going to be easier. So if there's already some transitioning happen, or there's already a plan for what agency will provide support, or if that person has the financial ability to at least stay in their home for another year, that's all going to really help the person adjust to the big major thing that's happened in their life, which is the loss of a loved one. And then we want to also be using natural community support. So that might be religious, that might be peers, that might be neighbors. Maybe setting up some people who will check in on them to become those visitors if their parents are no longer able to visit them, and that's a loss that they might be facing. So I just really want to take a minute to encourage you with all the people we support. I know in the 10 Start program, we have a lot of people who come to us with grief, or who might be facing grief, that we want to always consider this and help people make a plan. Coping with the loss, I think we touched on this a few times. Offering the person a choice to attend the funeral and other services, I think, is really, really important. And you might want to, like the person I was mentioning, let it be a private chance to go into the viewing or into the funeral room and to see how the person feels, to see if they want to stay. But allowing them to be involved is really important. And then also that communal family grieving. A lot of times there's a meal afterwards, or people are kind of together, maybe cleaning out mom's stuff, that sort of stuff. And it's not that the people that we serve can be involved in everything, but no one can. So just like with any family, you might want to talk about, like, what part can this person be a part of? And then provide reassurance through, listening, answering questions, and having the conversations, I think, is really. And then after the loss, again, plan to avoid changes as much as possible for the next year, if you can. Also, avoid any major assessments of, like, fit for services, or need for major psychiatric changes, because regression and psychiatric and behavioral symptoms are expected as part of grief. So if we move too quickly to say, oh, this person's unstable, they can't remain in their home, then we've kind of layered on another loss, when it might be that the person just needed some supports in getting through the grief. If we can, assist in the searching behavior, like we talked about, going to the cemetery or old favorite places that the person enjoyed with the person they lost. And again, like I said, many people we work with in START are dealing with losses. And I think so many people we serve, and all of us, are dealing with losses. So I think it's so important to remember that as we go forward. Just quickly, I just want to note that there's normal grieving, but there might also be a time to intervene with more support. So that could be individual therapy, group therapy. The research seems to imply that the people we serve can benefit from these same therapies that anyone else would reach out to and access. So it's just a matter of finding the right place and the right therapist. If there are signs of clinical depression, if there's major impaired function or suicidal ideation, you definitely want to get some immediate intervention, because the person might be really suffering the symptoms of grief. escape out of here and stop sharing. Kind of rushed through that end part because I wanted to get to it all, but there's a lot to this, and I think it's a project and it takes a lot of planning to help people really be prepared for
Go
grief.
off screen because I keep cycling back, having a difficulty with my bandwidth. But Michelle, we had a comment in the chat box down there.
Yeah, I think Johnny was commenting earlier before we showed the video, just talking about when he was working in inpatient psych hospital settings, significant number of people who were coming in who had contributing factors related to loss or grieving, and just talking about, you know, not being able to communicate those issues, as Carrie touched on as well. So I also just want to take this time while I'm talking about his comment to say, great
Evokes so many things.
Go ahead, Bruce.
No. You were in the middle of something there. I apologize. Go ahead.
No, you're fine. I was just going to say it was a great presentation, Carrie. I think you really touched on a lot of pieces there. I especially like the part about not making major changes or jumping to interventions in that first year. I don't know if anybody's familiar with that ball in the box analogy for grief, but thinking about your life as a box and grief as the ball. And initially that ball is going to be really big and there's going to be a lot of pain associated. And it's going to take up a lot of your lifetime or a lot of your life. And that goes for people with IDD as well. But also thinking about as grief starts to shrink and get a little bit smaller, if something triggers that grief, it's going to be just as painful as the initial. So just kind of being able to recognize and plan for those and have some supports in place, I think is huge for everybody, not just individuals with IDD.
Oh yeah, there were so many things throughout that the original presentation and yours as well, Carrie, that evoked so many things for me. And I was thinking back to a few weeks ago, we had Kimberly Best and our Honoring Choices group on CCN, and they were talking about end of life planning, a lot of end of life planning, which is a great. It's hard to talk about this in terms of being a great thing that you're doing, but it really is a way to prepare yourself, not just for your own end of life, but for the end of life of others that are going to be around you, because this is something everyone is going to face. I was thinking about a few comments from the present I thought were particularly meaningful. IQ. That I think is a real critical thing to understand, is that people with ID have the same feelings that anybody else does, and they need the opportunity to process those and deal with those things. Grieving being a springboard for positive growth is a key aspect of some of the things you were talking about. And as you were talking about all of this, one of the things I have the greatest trouble with is figuring out, what am I going to say to somebody, And the fact of the matter is, it really doesn't matter how much you say or exactly what you say. It's that you're there for someone when they experience a loss, and that you're there, you're supporting them through that process. You talked about learning from every day. So like when you're watching TV and you have an opportunity, a learning opportunity, you talk about things then. You're getting people, to understand more about death. And I just was thinking, as you were talking about rituals that people went through, like the person that went to Chick-fil-A with their parent, and then after they died, they continued that. My love for the Atlanta Braves came from my mother. She was the biggest Atlanta Braves fan that ever lived, and I continue to honor her each and every year by continuing to be a Braves fan. And she would be so excited right now about everything that's going on. But I appreciate so much you coming on and approaching this very important topic. I think you were right on target with everything you had there. Thank you so much for being here today, Carrie.
Thank you. It was great to be here and to share this information.
And thank you all for being here. And I hope you will heed Carrie's advice here and make sure that we're approaching grief and bereavement for people that we support. And so please be with us again next week. Karen Wills is going to be our host next week. So I hope you'll join us again next week. We do it every Tuesday at 12:30, the Clinical Consultation Network. We'll see you next week, folks. Bye-bye.